You're watching Beyond Markets, where we bring you up to speed on development outcomes in Africa. I'm Kenneth Igbomor, and thank you so much for joining me on the show today. Coming up on today's show, we'll discuss ways to ensure that the progress made on other diseases in Africa do not suffer as a result of the COVID-19 pandemic. And you can join the conversation and let us know what you think online. The hashtag to use is Beyond Markets. You can also hit me up at Kenneth Igbomor. Now, the COVID-19 pandemic has exposed gaps in the healthcare systems around the world. The Access to Medicine Foundation says after decades of investment for ending HIV, malaria, and tuberculosis pandemics, the progress made in protecting children from the diseases is now at risk due to disruptions caused by the COVID-19 pandemic. And I have with me Jayasree Iyer. She is the Executive Director to the Access to Medicine Foundation, and she joins me now from Amsterdam to discuss how best to address Africa's disease burden. Thank you so much for joining me on the show today, Jayasree. And I'd like to start up first, by understanding how the COVID-19 is adding to a long list of diseases Africa has been grappling with over the years.
Yeah, thank you again for having me on the show. Well, COVID-19 has had a really big impact on people's lives, but I think importantly what we've shown in this study is that COVID-19 has sort of created a platform where we have seen a threat to progress and a threat to some of the progress that has been made by many different stakeholders on combating HIV, malaria, and tuberculosis. And obviously this will have a subsequent impact on mortality and infection rates. In fact, we find that about 73 countries are already at risk of running out of HIV medicines, and 24 of the countries around the world have already declared low stocks of HIV medicines as a result of COVID. So this is really a serious issue.
But then it's a scale of interventions needed to address these issues. You just mentioned the challenges with HIV. I'm sure there are way other diseases and different challenges on board, especially with malaria and tuberculosis.
So the scale of the problem is actually bigger than what we realize, because there's not a lot of reporting around on it. But take for the example of in sub-Saharan Africa, where millions of people live with TB and HIV, a lot of treatment centers have been converted into COVID-19 wards. And in principle, that's actually pretty good that we can sort of still build COVID-19 response based on decades of investment in proper healthcare systems and wards and hospitals that have been built for HIV and TB. But the problem is that right now resources are being redirected towards COVID that otherwise should be there and made available for HIV, malaria, and TB patients. We estimate about 471,000 deaths from HIV are going to be there due to COVID-19. And in a country like Nigeria, who has the third largest HIV epidemic worldwide, Nigeria is predicted to have 35,000 extra HIV-related deaths due to COVID alone. And this could rise higher if the COVID disruption is actually longer than expected, or if we don't actually stop this pandemic in its tracks. And we're also seeing this with malaria. 12 countries in sub-Saharan Africa are predicted to see deaths from malaria rise by 150 to 200% if bed net and treatment programs are severely interrupted. So all the work that we've done in combating diseases that are age-old and keep burdening patient populations all around the world are being interrupted because of COVID-19. And I think what we're hoping to see right now is a lot more solidarity, a lot more resilience, and a lot more partners really stepping up the game to realize that this is not a pandemic where we are only targeting COVID, but we need to keep our commitments in place so that we're really stopping HIV, malaria, and TB also on its track.
The COVID-19 pandemic also opens up a huge opportunity to rework healthcare systems across Africa. I'd like to hear your thoughts on this.
Yeah, so there's a range of opportunities. Our main audience is obviously the pharmaceutical industry, for them to realize that this is the time when a lot of efforts are going towards coronavirus, and that should be made available for people living in low and middle income countries. It also means that when they are coming up with a response to coronavirus, the products that are brought together, whether they be drugs, vaccines, or medicines for regular hospitalizations, because coronavirus patients don't show up only with coronavirus symptoms. They need oxygen, they need ventilation, they obviously need lots of different injectables, stabilizers, saline, and all that needs to be provided at an affordable cost for patients all over the world in that sense. So I think the pharmaceutical industry, it's a bit of a turning point for them into realizing that, look, it's not only about a single product access, it needs to be supporting the entire health system. For governments, I think it's also an important aspect for them to realize, like listening to what's happening with COVID, what are the ways that they can sort of safeguard healthcare in general? How do you make sure that the oncology programs that are running, the efforts that are going to ensure universal health coverage and that all patients receive access in the public sector, and how do you redirect resources to make that in place? I think especially when you're talking about businesses, it's also a place where we see a lot of role for private sector to step into the game with either funds, expertise, or network in order for them to say, like, how can we contribute to this particular pandemic in a way that is meant to be sustainable over the long term. African manufacturers are, I think we're in discussions with quite a few of them, hopefully are using this momentum to also expand their portfolio, expand their capacity, and the distribution channels, because they've got the actual network to do this, and build those partnerships with pharmaceutical companies, with the government, in order to sort of sustain a better response for not only coronavirus, but just all the areas that need attention at this moment.
It's just a decade for the countries around the world to meet the Sustainable Development Goals, the targets set, earlier on. But I'd like to understand the level of effort that is needed right now to ramp up the efforts so that at least at the other end of the curve, we don't come out worse.
Yeah, Sustainable Development Goals are a way for all of us to understand what are the top priorities around the world. And I think when we're looking at the top priorities around the world, most people would say, okay, we're able to commit to targeting those top priorities. But what we're looking at here are real tangible actions. And the tangible actions that work in one country are obviously different than the ones that work in another country in that sense. So what we really need is a platform where good practices are shared. It's like what is really truly working in a particular situation or a country. The more we can bring, a level of information out, the easier it is for different country leaders to understand, okay, what are the different tactics that are in front of them. The second is investment. We need to find a way to sustain the investment, either in terms of global development or local development itself, that needs to be in place to maintain that level of progress. And I know it's not easy, because at the end of it, a lot of budgets are extremely stretched at the moment across the whole world. But I think it's important that, look, if we let COVID really win this battle completely and sort of completely derail everything that we've ever done, then we're going to be in a bad off situation in that sense. So making effective choices that really build a system, I think it's an important aspect of it. The Sustainable Development Goals have been something that governments around the world, private sector companies, pharmaceutical companies, investors have all been speaking about, saying, like, look, we can subscribe to this. We do believe that a longer term sustainable approach is what's going to solve the problems that have been identified in the Sustainable Development Goals. But now it's time to sort of really walk the walk and really show that this is actually in place. So we're also working with a group of institutional investors and development finance organizations around the world to see how do they ensure that there is going to be that level of pandemic preparedness and investment, so that people all around the world really benefit from access to healthcare.
Talking about walking the talk, quite recently we had the Ebola scare, and I'm trying to imagine the type of lessons we would have learned from that entire process.
Yeah, Ebola was I think a scare internationally, because it was a way for us to realize that the research and development pipeline was actually not ready unless you actually invest in it in order to come up with a new vaccine or even a new diagnostic for us to be able to distinguish between Ebola at an early enough stage to do something about the problem for patients in that sense. And the second thing is that we would notice that Ebola, since it was everyone expected it to be sort of regional in focus, was not something that you end up having the whole world binding together. And that's how pandemics have been over the last few years. We don't seem to realize that these are not threats that threaten one particular nation or a small population of around the world. These are threats that we need to step up the game in. So what we've been looking at is how does the industry really been strengthening their research and development pipeline, making sure that their compounds, their assets, the drugs that they've been developing are made available to be tested for in the case of Ebola, in the case of coronavirus, so that they are able to offer a quick response when the next pandemic comes about. And I think this is important for us to realize that coronavirus is not the first pandemic, so we have a lot of history to learn from, but it's also not going to be the last pandemic. So whatever we build now has to be there to stay. So a lot of companies and governments are starting to realize that, okay, we need to pool together our resources. We need to make sure that the research and development pipeline is there. We need to make sure regulation and investments are also agile and able to step up the game when we actually have a pandemic in our hands. And we need to be able to deliver it, because at the end of it, patients can't wait.
When you look at the impact across the impact of the three big diseases of COVID-19 on the three big diseases we have, I'm trying to understand how the regions in Africa stack up when you look at East Africa, West Africa, and Southern Africa.
Yeah, it's actually quite well documented in terms of the disease burden around the world for these three diseases, purely because we have a lot of years of working with these diseases. So at the moment, these three diseases still account for about 500,000 children's deaths per year. And a lot of times, this is also a focus specifically on children who are under the age of 5, where they're the most vulnerable to infectious diseases. When you think about the work that's been done in the past, it's about 1.7 million new HIV infections have occurred in last year, in 2019. And that's much less than we had years ago in 2010, let's say 9 years before that. And we do have already a goal of 75% of reducing the burden of disease, and we're almost there in that sense, So when you think about it, in sub-Saharan Africa, the main burden of the disease is still limited towards young people, especially girls, young women. Stigma plays an important role still. Education plays an important role still. Improving health-seeking behavior so that people are not afraid of coming for healthcare and not afraid to speak up when they have HIV, malaria, or TB, I think is really important. So in sub-Saharan Africa, girls and younger women make up about 10% of the population, but they account for about a quarter of new HIV infections, as an example. I think this is something that we need to pay attention to. Who are the vulnerable populations that are most often left out of solutions, and specifically make sure that whatever solution we're bringing forward for HIV, whatever solution we're bringing forward for coronavirus is also including that population. Malaria, for example, the bulk of the disease in malaria is actually happening in sub-Saharan Africa itself. And about half the deaths are caused not only by just the disease itself, but deaths are caused by substandard and false medicines that are out there. So we need to pay attention to quality medicines that are out there. There's actually data out there that says 1 in 5 of the anti-malarial drugs that are out there are actually fake. So it tells you the extent of the problem, that while we do have medicines, patients are receiving either the wrong ones or are not even getting access to the right ones. And TB, similar problem. It's more of a worldwide issue, so there's a lot more awareness of a disease like TB. It's the top 10 causes of pediatric deaths. 2 years ago, it was about 10 million cases were reported, and about 1.5 million deaths itself. And 80% of these cases occur in high burden countries where you do have people living in close contact with each other, poverty, and not a very strong healthcare system. And most of the 30 high burden countries are also in sub-Saharan Africa. So I think it's important for us to realize that the sub-Saharan African continent really needs to be part of the front and center response for any disease response that you have globally.
Jayasree, I needed to hold that thought for a second. We'll go to a quick break, and definitely when we return, we'll be looking at the stages and areas for intervention, from research and development even to the point of finding a cure. I've been speaking to Jayasree Iyer. She's the Executive Director for Access to Medicine Foundation. Beyond Markets continues after the break. Welcome back to Beyond Markets. You're joining us on the show today. My guest has been Jayasree Iyer. She's the Executive Director for Access to Medicine Foundation. And she's been talking about how we are assessing how Africa can better protect the progress made in fighting the disease despite the COVID-19 pandemic. And Jayasree, just before we left off, I'd like to start off now looking at the stages and areas for possible intervention, starting from research and development. I'd like to know what areas in R&D that you think can help move the needle for healthcare in Africa.
Yeah, in research and development, while there's been a lot of progress made, I think we need to find a way to sustain that progress. So one, we do need to make sure that the top priorities in terms of exactly what children need are being developed by the pharmaceutical industry. And that's not just being developed by an industry on its own. They need to really develop it with users in mind, with doctors, with patients, with caregivers in mind, because we need the right treatments tailored for children. That's been actually something that's important for malaria, which is already affecting children, and it predominantly affects young children anyway. But for HIV and tuberculosis, what you end up seeing is that medicines are first being developed for adults, and then only after an adult formulation is already available on the market, then the development of children's medicines is being created. Internationally, there's been a lot of regulation that now tries to incentivize the research and development to sort of ensure that children's drugs are actually being made faster. But at the end of it, children still have to wait significant numbers of years before they get their medicine, and that's need to change. So we do need better drugs. We need drugs that are also available that combat drug resistance, since many of these drugs are proving to be not as effective as they used to be. And we need faster approval so that children get access to these medicines as quickly as possible.
When you look at research and development, and when you look at how the process that goes into formulation of drugs, I've heard some experts talk about the fact that the African gene pool is not well represented in genomics research leading to making drugs. I'd like to get your thoughts on this.
Yeah, at the moment, it's not very well represented generally for drug development. For medicines that are predominantly affecting the African population, clearly, when someone is actually developing a particular medicine, they do end up testing it in a few African countries. What the problem ends up becoming is that one, the pharmaceutical industry needs to see a clear incentive, and a typical incentive for the pharmaceutical industry will be based on the market, whether they're able to make a significant amount of profit and revenue in certain countries, and because of that sort of a business model, they tend to overlook the fact that you're not really doing this to serve the patients at the end of it. So a lot of countries, especially the ones that have a large number of people living under the poverty line, especially the areas where there's market failure, tends to be overlooked by the pharmaceutical industry. So we do need to pay more attention to this. In the years that have passed so far, there's been a lot of different incentives that have tried to bridge that gap. One is additional funding that de-risks potential failure in research and development, because sometimes the medicines just don't work and they're not as effective. But the second is also, more transparency and openness about knowing that clinical trials really have to be conducted, and you actually have a good representation of the patients who are really suffering the burden of the disease in your studies itself. And I think that's an important factor that we need to continue speaking about and advocating for in order for this to become mainstream.
Moving on from research and development, I would like to move on to the area of diagnostics. And when you look at Africa, what would you say are some of the key challenges we're facing in the space of diagnostics?
So the main issue is that you don't actually have very good point of care diagnostics. And when you do have the right diagnostics in place, they're often not utilized by trained professionals at the right time. Technically, you should be able to take a diagnostic and tell the difference between the kind of infection a person has, let's say take for the matter a child, and whether that infection is something that can be potentially treated with a particular disease. I think the situation has actually been improved quite significantly for HIV and for malaria, where there's been a lot of innovation in terms of the kind of diagnostics that are there. Tuberculosis remains a pretty big challenge, because right now we see that diagnosis is really an issue, especially for children. When a child presents with a cough, you need to really immediately find out whether a child has tuberculosis or another infectious disease. And often, also with coronavirus around right now, we don't even know whether a cough is tuberculosis related or otherwise. And people tend to have a fear of coming forward with a cough, which doesn't make the situation easier. And then after you diagnose it as tuberculosis, the second step with a lot of infectious diseases nowadays is to understand whether this disease is actually going to be targeted with a particular drug, or is it already resistant? Is it a kind of bacteria that is already resistant to the kind of drugs that are available in that population itself? Thirdly, a lot of people don't come for diagnostics, and doctors also don't do the proper diagnostics because potentially the drugs are also not as available as it should be. So you don't necessarily want to promise people the ability of having of a treatment for a medicine when the treatment is actually not available. And so we need to look at supply and affordability of the medicine itself in order for the diagnostic to really work properly in that sense. And this has been a severe problem, especially in tuberculosis, if I have to pick an area among the three diseases that we need to pay some attention to.
I'd like to move on to the area around access to healthcare centers, and even the quality of the care gotten from those centers, and even the access to medicines as well. I understand that you play quite a lot of role in that sector, and I'd like you to speak from your experience so far and how we can, help tweak things around to get better outcomes.
Yeah, I think the first step is in understanding what access is necessary, and I think from the public sector point of view, identifying especially the vulnerable populations, what is the population able to pay? So it's not only at the hands of the pharmaceutical industry or any producer to come up with a final price, but it's really a discussion on like what is the population able to withstand, what proportion of the healthcare budget is able to be invested into offering healthcare and health coverage for key diseases in that sense. Access is a two-way street, right? At the end of it, we want pharmaceutical industry leaders to think about what does it mean when you're developing a product, when you do need to ensure broad access. It can't be based on market promise. It can't be made based on profit. It needs to be based on the countries and the populations that have the highest burden of disease. And the only way they can do that is if we keep making sure that becomes the gold standard. And around the world, there's been a lot of information right now in priorities. So people around the world, stakeholders from the World Health Organization, from academics, from institutions, public and private, from patient organizations have come together to identify here are the top burden diseases that affect us. If we know what the disease is that we need to target and we have the compounds for it, then what we need to do is sort of bridge that gap to make sure the innovations are actually there. But it's not just good enough to have the innovation. You need to make sure the product is actually affordable and there's enough supply. Now, the particular problem that Sub-Saharan Africa faces is that most of the medicines and vaccines that Sub-Saharan African people use is actually imported from other countries outside. Even basic things like antibiotics are all mostly brought in from India and China. So supply security is really a major issue for older medicines and any new medicines at the end of it. So we do need to pay a particular attention on how can African manufacturers, how can investors in the African manufacturing system, how can investors in the African health system find a way to ensure that stocks and supplies of medicines are actually there and available for patients when they get diagnosed with a particular disease in that sense. And I think with the fact that we're dealing with infectious diseases that affect children, you do need to remember that we will have drug resistance if we don't use the medicines properly. We will have drug resistance if we don't safeguard how it is being utilized and sold already in the markets at the country level. And we do need to find a way to make sure that quality medicines are what people have access to, not the stuff that is bad quality and rampantly available all around the world.
All right, Jayasree, thank you so much for your time. Quite a lot you've said and a lot to ponder on, talking about, the healthcare system and understanding how we go from research and development even into finding cure for drugs. I'd have loved to get into the area of finding medication, the process of medication and the dynamics around that, and vaccine development. But unfortunately, that's all we have time for on the show today. Thank you so much for your time on the show. I've been speaking to Jayasree Iyer. She's the Executive Director for Access to Medicine Foundation. And thank you so much. That's it on Beyond Markets. You can catch the show at 5 p.m. West Africa time daily and have access to all episodes of Beyond Markets on our website. That's at cnbcafrica.com. You can also hit me up at Kenneth Igbomor and let me know what you think about the topics that we discussed. From me and the rest of the team, have a wonderful day.